We're learning about skin cancer, what it is, what it does, and giving you the facts to know your body. Cells in practically any part of the body can grow out of control and turn into cancer cells. Skin cancer is the result of cells in the skin growing uncontrollably and forming cancerous tumors. This happens when mutations are triggered that turn the skin cell abnormal and cause it to multiply rapidly. There are three main types of skin cancer: basal cell, squamous cell, and melanoma. Basal cell is the most common, accounting for 8 out of 10 skin cancers. About 2 out of 10 are squamous cell. Both are highly connected to a person's sun exposure and tend to be found on or around the head and the neck. It's rare that either of these spread to other parts of the body, but that doesn't mean it can't happen. Melanomas are the most serious type of skin cancer and form from melanocyte cells. If not treated early, it can spread quickly to other parts of the body, and treatment becomes much more difficult in later stages. Skin cancer is the most common type of cancer in the United States, with 1 in 5 Americans developing it in their lifetime. And every day, an estimated 9,500 Americans are diagnosed with skin cancer. Anyone can develop skin cancer, but the most common risk factors include skin that burns easily, having blonde or red hair, history of excessive sun exposure, including sunburns, tanning bed use, diseases or treatments that suppress the immune system, and having a history of skin cancer. Early detection is crucial, and knowing what to look for could save your life. Let's talk with our expert dermatologist, Dr. Jabber, for tips on how to stop skin cancer before it starts. Dr. Jabber, what are your recommendations for early detection?
It's important to do a monthly skin self-exam. Get in front of the mirror and get to know your body, so if something is different or changing, you can have it assessed.
What does skin cancer typically look like?
Basal cells typically show up as pimples that scab and bleed and don't go away. Squamous cells can be rapidly growing painful sores, or they can be more itchy, flat scabs that are non-healing. Melanomas are irregular moles that look different than other moles on your body, or they can be moles that have changed, itched, or bled. These are just guidelines. If you see a mole you're concerned about, make sure you see a Board Certified Dermatologist so they can take a closer look.
What are your top tips for prevention?
It's really important to practice sun-safe behaviors. 5 sunburns in your life increases your risk of basal cell and squamous cell by 70% and melanoma by 80%. So the best way to prevent skin cancer is to be smart about the sun. Wear a hat, put on sunglasses, make sure you're using an SPF 30 or higher sunscreen, and reapply every 2 hours. Have a great time outdoors, but be sun smart and sun safe.
Thank you, Dr. Jabber. Those are some great tips to be reminded of. And now you know your body.